In this video, we are going to discuss how the Self-Identified Patient Perspective tool will help you align your professional's financial philosophy to yours. You will use the Self-Identified Patient Perspective tool to communicate to your clinician in order to help them make a more financially sound treatment plan. And by the end of this video, you should have no problem figuring out which financial philosophy works best with you. So let's get down to it, shall we? There are 4 types of financial philosophies in which patients can classify themselves in. Number 1, the insurance-driven patient, the best practice patient, the rogue patient, and the experience-based patient. The insurance-driven patient is one that likes to play by the rules. They rely heavily on their insurance's financial assistance. They treatment plan to coincide the insurance's schedules. And they seek care with contracted in-network providers only. Whereas the best practice patient prefers to stay on the road most traveled. Characteristics of the best practice patient is that they would seek payer assistance whenever possible. Pretty much they treatment plan for insurance's purposes, but may seek care outside the scope. And they might have highly covered insurance, with a number of options of in-network providers. If you are the rogue patient, you will apply in-network payer options whenever possible. You will treatment plan for convenience, location, and the experience that meets your treatment goals. You may have limited in-network resources and may seek cash-paying options if the desired care quality is preferred. If you are the experience-based patient, payers generally do not factor in with your healthcare treatment preferences. Your treatment plan is for convenience, location, and reputation of the practitioner. You also seek care for an experience-based match with your provider. And for your homework assignment, you are to classify which patient type best matches your financial philosophy.